Yeah, so I think, like I said in the last answer, I think the challenge is that there is so much coverage that some of the cost of that coverage is going to come into play, and employers are going to need to use centers of excellence, narrow networks, prior authorization of care to kind of redirect some of that care. I think that's the number one thing. Number two, I think that there are more and more experimental drugs that are coming on the market that are biomark drugs or biopharmaceutical drugs. As those drugs come to market faster and in more quantity, employers are going to be faced with the challenge of what is the right genetic testing or pharmacogenetics that needs to be put in place in order to manage that marketplace, because these drugs are very costly. They're earmarked to a gene, and I think sometimes physicians will want to use as many things as they can in cancer care, and sometimes we'll go outside of the testing. And I think employers are going to be forced with having to put some of those tests in place, and picking the right one can really be a challenge. And third, I think the third biggest challenge is, as you look at the cost of cancer care, the biggest challenge employers face is cancer care is very emotional. It is one of the most challenging areas for an employer to make changes, or what would be perceived as cutbacks, because it is an emotional disease. And when somebody wants cancer care, they don't want to have to fight through a number of things. They want to get the care they need. They want to try as many things as they can to prolong life or to become in remission. And so I think it's important that employers understand that balance between controlling cost and then the emotional fight that's happening at a behavioral level for the individuals and the family. And I think those things all come together to really make it a very interesting place to play in, and trying to make the right changes at the right time for the right reasons. Understanding all of those is really the mix, particularly in cancer care.